Today we will be discussing about instruments and materials. In this class, I will be introducing to you the basic instruments and materials which are routinely used in orthodontics. The discussion will be very brief in a theoretical manner, and detailed explanation about practical aspects, clinical application of each instrument and material will be discussed in upcoming classes, and you will be familiarized with all these instruments and materials at the end of the course. In this class, I will be just speaking about the instruments and their theoretical aspects pertaining to their clinical applications. Okay?
This is light arch wire plier. It has a round beak and a flat beak. This plier is used to hold the arch wires in fabrication of the arch wires, for placement and removal of the arch wire into the brackets and the buccal tubes, and also the light arch wire plier is used for placement of metal separators. This is pin and ligature cutter. It is used to cut the lock pins in beg technique and ligature wire after tying the arch wire into the brackets. This is distal end cutter. This instrument is used to cut the distal ends or the ends of the arch wire that projects behind the buccal tubes, so that excess wire might be removed without any impingement to the soft tissues behind the molar. This is Wingard plier. This instrument is used for placement and removal of arch wires into the buccal tubes and brackets. It is also used for placement of elastomeric modules and also for placement and removal of removable transpalatal arches into the lingual sheaths. This is arch wire cutter. It is used for cutting the light arch wires. It should not be used for cutting the heavy wire. Its cutting edges are made up of tungsten carbide. This is band contouring plier. It is used for contouring the bands and also for contouring the crowns in order to adapt to the bulged buccal and lingual surfaces of the molars. This is how the instrument is used, so that its buccal and lingual surfaces will get adapted to the bulged anatomic contours of the tooth. This is straight hoe plier. Its tips carries serrations on the inner side. This instrument is used for initial placement of bands around upper molars. It is also used to adapt the molar bands on the palatal side of the upper molars. This is curved hoe plier. Its beaks are angulated. The ends of the beaks carries serrations on the inner side. This instrument is used to hold the band and for initial placement of bands on the lower molars. It is also used to adapt the bands onto the lingual surface of lower molars. This is Tweed's loop forming plier. It is used to form small loops into the arch wires. This is band cutting scissors. The cutting blades have tungsten carbide cutting edges. It is used to cut the band material. This instrument is called as band pusher. The tip of the instrument has serrations. It is used for final seating of the band into the interdental spaces. It is also used to adapt the bands to the circumference of the molar. This is Matthews needle holder. It is used for placement of elastomeric modules, for tying the ligature wire around the brackets. It is also used at some times for placement and removal of arch wires. This is band remover, used for removing the bands from the teeth. This is bracket remover, used to remove the brackets once the treatment is completed. Its beaks have angulated projections which go into the tie wings of the brackets, and the bracket can be twisted or subjected to shearing force so that they will get easily deboarded from the teeth. This is Adams plier, which has flat beaks. Both the beaks are flat with a groove to hold the heavy stainless steel wire. This instrument is used for wire bendings of heavy wires, mainly used for fabrication of Adams clasp. This is universal plier, used for basic wire bending exercises, especially in the fabrication of removable appliances. This is heavy wire cutter, used for cutting higher gauge wires like 21, 22, 23, 19 gauge stainless steel wires. Usually this is used for for cutting the wires used for fabrication of removable appliances. This is bracket tweezer. It is used to hold the brackets while bonding onto the teeth. Its ends have serrations on the inner side so that the brackets can be held in position without slipping. This is called as Boone's gauge. It has markings on it. It is used for correct positioning of the brackets vertically at a appropriate height on the crown. This is used for correct vertical positioning of the brackets. This is another set of bracket positioning gauges which has markings on them used for correct vertical positioning of the brackets on the teeth. This is called as tie and tucker. The ends of the instruments has slots. This instrument is mainly used to place the arch wire into the severely malformed teeth brackets. In the other way, the arch wire can't be kept or can't be engaged completely into the brackets bonded onto the severely malpositioned teeth. In such cases, this instrument is used to engage the arch wire completely into the brackets of the mal-aligned teeth, thereby facilitating ligation. This instrument is also used to twist or bend the free ends of the ligature under the arch wire so that the sharp edges of the ligature wire will not hurt the patient. This is spot welder. It is used for welding the band material while fabrication of bands onto the molars or any teeth. This is separator placing plier. It is used for placement of separators between the teeth to facilitate opening up of space for full engagement of the bands onto the molars. This is the manner in which the separator placing plier is used for the placement of elastic separators. These are lingual cleats used for bonding on the lingual side of the teeth, particularly in the correction of rotations. These are lingual buttons. Similar to lingual cleats, lingual buttons are bonded onto the lingual surface of the teeth. They aid in engagement of the elastics to correct the rotations of the teeth. This is Beck bracket with flat base. It has a vertical slot. It is used for bonding onto the teeth that has flat surface. Those are nothing but maxillary and mandibular incisors. These are Beck brackets with contoured base or curved base. These brackets are used to bond onto the teeth having curved surfaces like canines and premolars. This is ligature wire spool. This wire is used for ligating the arch wires into the brackets. It is also used for placement of active tiebacks and lacebacks. It is also used for consolidation of the arches, forming them as a single unit. This is how the ligature wire is cut into small pieces and twisted into the loops as shown in this image, and these loops are used to tie the arch wire into the bracket. So Using Matthew's needle holder, we ligate the arch wire into the bracket using ligature wire. This is band material spool used for fabrication of bands around the molars, premolars and incisors. Usually we will be banding molars. Banding of incisors and canines and premolars is rare and it is used in only specific situations. These are preformed bands. We also have preformed bands with buccal tubes welded onto them. The preformed bands are available of different sizes. In this image you can see on the band it is written as 36.5, RU 36.5. It implies upper right molar band with number 36.5. So we have bands which are preformed with attached buccal tubes of various sizes that suits according to the size of the molars of the patient. This is straight wire bracket which we routinely use. Each straight wire bracket has a horizontal slot and 4 tie wings. Each bracket has a dot on the distogingival tie wing. Can you see in this image the violet color dot is present on the distogingival tie wing, and on the mesiogingival tie wing there is a hook for the engagement of elastics. This is self-ligating bracket. When we are using this bracket, there is no need for ligating the arch wire either with the module or with the ligature wire. Can you see the orange color portion of this bracket? It can flip up and down. That means it can close the slot as well as open the slot. So it serves the purpose of ligature wire. This is ceramic bracket whose slot is made up of metal. With this bracket, the friction will be less when compared to a ceramic bracket with a ceramic slot. These brackets have another advantage that they are aesthetic and at the same time the resistance while retraction is reduced due to the presence of metal slot. This is straight wire buccal tube with hook. It is used for bonding onto the molar. Instead of preformed bands with the buccal tubes, we also have buccal tubes that can be directly bonded onto the molars. These are straight wire buccal tube. It's a double tube. The bigger tube is used for engagement of or for insertion of face bows of the headgear, whereas the smaller rectangular tube is used for the engagement of arch wires. This is a triple tube. The middle tube is used for engagement of arch wire. The gingival tube is used for engagement of auxiliaries. The occlusal large round tube is used for placement of face bow when we are using headgear. This is a lingual sheath. It is used for welding onto the lingual surface of maxillary molars so that we can insert removable transpalatal arches or quad helices or any kind of anchorage reinforcing component onto the lingual surface of the molars. This is invisible aligner. It's a newer technology where such kinds of invisible aligners are used in a sequential manner to align the teeth without necessitating or eliminating the necessary of brackets. These are lingual brackets. Which are bonded onto the lingual surfaces of the teeth so that the patient appears aesthetic even during the course of treatment. These are the elastic separators that are in place between the molars. These are closed coil springs made up of nickel titanium. They are stretched between two groups of teeth and they are useful in closure of the extraction spaces. They are used for closure of extraction spaces. This is elastic chain. Elastic chain is used for closure of extraction spaces as well as spaces in the dentition. It is available in different colors. These are Knightec coil springs. As in the previous image, here you can see closed coil springs as well as open coil springs. So the open coil spring is usually cut into small segments and they are placed between two teeth or two groups of teeth to open up the space or to gain the space. Closed coil springs are used for closure of the space, whereas open coil springs are used for opening up the space. This is flux. It is used during soldering exercises. The flux is used onto the surfaces of the metals that are being joined. It removes oxide layers from the surface and makes the surfaces of the metals that are being joined amenable to the flow of silver solder. These are elastomeric modules. They are used for engagement of arch wires into the brackets. They are also used for closure of extraction spaces by using in the form of active tiebacks. Elastomeric modules are also available in different colors. This is how we place elastomeric modules around the brackets by using Wingard plier. This is silver solder used for soldering the accessories to the bands. This is soldering torch used for soldering the different components of the fixed appliances to the bands. It is soldering torch. These are reverse curve nickel titanium wires. They are used for correction of open bites as well as deep bite malocclusions. These are orthodontic elastics. They are available in different colors and are used for correction of class 2 molar relationship, class 3 molar relationship, open bites, cross bites, and also for settling the occlusion. Different elastics are used in different manner to bring about required tooth movement. This is AJ Wilcock wire. It is a stainless steel wire which is stiffer than the normal stainless steel wire which we use. It is mainly used in beg technique. It is also used in straight wire technique as a base arch wire for retraction of the teeth, where we require much tipping than bodily movement. These are TMA wires. TMA stands for titanium molybdenum alloy. These wires are particularly used in the fabrication of loops for retraction of the teeth in straight wire technique of fixed appliance mechanotherapy. These wires have good strength when compared to nickel titanium wires, and they have good spring back. This is why they are used for fabrication of loops for closure of the extraction spaces. This is lingual arch. It is made up of 19 gauge stainless steel wire. This is used for reinforcing the anchorage in the lower arch by soldering it to the lingual surface of mandibular molar bands. It is also used as a space maintainer in case of bilateral loss of mandibular molars. This is copper nitride wires. They have more copper content when compared to normal nickel titanium wires, and they are more sensitive to temperature changes. This is transpalatal arch. It is fabricated with 19 gauge stainless steel wire. Similar to lingual arch in the lower arch, transpalatal arch is used as anchorage reinforcer in the upper arch. It is soldered onto the lingual surfaces or palatal surfaces of maxillary molars to aid in anchorage.